One of the big factors of why I chose WSU is because of the simulation center. I really wanted an education that was going to foster me moving from a student into being a nurse and working in the clinical setting, and I felt like the education that WSU provided with the simulation and just that practice and being able to have that low pressure environment was going to allow me to succeed as a nurse, and that's one of the reasons why I chose WSU. Success is seeing that a whole group of us can go into the simulation and know very little about it, and then within a couple minutes we can make a diagnosis, make a plan, and execute that plan in just a few minutes, all while providing therapeutic care. One of the craziest things about our simulation is how realistic they are. You can hear bowel tones, you can feel a pulse, take a blood pressure, and that's just such amazing things, and pretty much as close to realistic as possible as you can get. And like I said, it's a very low pressure environment, and so that's great to have those very realistic things in that environment. The simulation center does provide us with confidence, but that can be seen in the clinical setting as well, because when we are in there, we have the confidence from the simulation center, and then that allows our patients to feel like they have someone that's taking care of them, that's prepared and educated, and I think that can be seen in the clinical setting. There is such a community around WSU, and that's very noticeable all the way from Tri-Cities to Spokane. You feel at home, you feel supported, and everyone is here to see you succeed, and they want you to succeed. And I have felt that since day one here, all the way from orientation to I know I'm going to feel it as I'm walking across that stage.